Do you or someone you know have an arrhythmia of the heart, or perhaps atrial fibrillation? We approached 3 cardiologists, all experts in the field of electrophysiology, to have a discussion about arrhythmia disorders and how to treat them.
The incidence of particular arrhythmias depends on the age of the population and which arrhythmia you're talking about.
One of the most dangerous rhythm disorders, atrial fibrillation, has an incidence of 10% of patients over the age of 80. And there are at least 5 million people with atrial fibrillation in the United States at present. In fact, there's about a 1 in 4 chance that someone will eventually develop atrial fibrillation over the age of 40 in the United States. This is concerning because atrial fibrillation is one of the most common causes of stroke.
We do have other types of arrhythmias which happen more commonly in youth, but these tend to be on the order of 5 or 10% of the population in general. Arrhythmia disorders can be diagnosed in many ways. The most common is usually by physical examination, as most patients feel a racing heart rate and they seek medical attention. An internist or a primary care provider can listen to the heart and feel that the rhythm is not regular. This then may result in further follow-up with an EKG, also called, or a Holter monitor, which allows us to specifically measure the electrical activity of the heart.
The first line of defense in managing an arrhythmia disorder is knowing which one you have. So diagnosis is the first line of defense.
Which means finding your healthcare professional and having the problem diagnosed, usually by physical examination or by an EKG or a Holter monitor. Depending on the problem, immediate action can be achieved and hopefully bigger problems prevented in the future.
Certainly the most serious form of arrhythmia is one coming from the lower chambers, often referred to as ventricular tachycardia or ventricular fibrillation. These rhythm disorders are potentially lethal, but if caught in time, are potentially curable with a fairly brief and simple procedure called a catheter ablation.
Depending on the type of arrhythmia, there are different treatment options. Most arrhythmias of the top of the heart can be treated with medications and intervention, which is minimally invasive and which is potentially curable. Arrhythmias from the bottom of the heart can require intervention in the form of a defibrillator or a pacemaker, or sometimes requires interventions from an angiography standpoint. But all of these can be treated both with medications and or intervention depending on the severity, which is why it's again important to have these evaluated as soon as possible.
There are devices that either take care of the heart when it goes too rapidly or take care of the heart when it goes too slowly. So pacemakers have been around for quite a long time now, and pacemakers are designed to keep the heart above a certain rate. So once a pacemaker is implanted, which takes, plus minus 30 minutes to an hour, once that pacemaker is in under the skin, we can actually talk to it by radio communication, and we can program it and we can look to see what rhythm disturbances may be occurring because these pacers have diagnostic capabilities in them. So they're very, very useful devices. On the other side of that spectrum are devices that take care of the heartbeat when it short circuits or goes too rapidly, and these are called automatic defibrillators. And there are surface automatic defibrillators, AEDs, that you may see in airports or other places. They're the same thing as implanted ICDs, or implantable cardioverter defibrillators, and they're designed to look at the heartbeat, follow it along, and if it short circuits into a very, very rapid rhythm, immediately respond by delivering a shock. So with automatic defibrillators and dangerous life-threatening rhythms that require shocking, time is of the essence. Automatic defibrillators operate within 10 to 20 seconds, and that's their great value.